Welcome to this edition of Leading Experts. I'm Carissa Farley. Today we'll be discussing cutting-edge methods for individuals and groups to heal, transform, and fulfill your life with Dr. Elizabeth Borg, a licensed psychologist, wellness and life coach, and a public presenter. Leading Experts starts right now.
Welcome to this edition of Leading Experts. Leading Experts is informative and exciting. Leading Experts interviews authors, speakers, and entrepreneurs in all areas of business, so you become a much more informed consumer.
Dr. Borg is a wellness and life coach and a public presenter. With her unique background and training, she assists people in holistically fulfilling their life potential. Welcome, Dr. Borg. I'm thrilled to have you today. So many people are looking for answers on wellness and don't quite know where to go.
Yes, that's true. They're really caught somehow in standard medicine today. They're caught in the medical model, and I represent the alternatives to that.
You have a unique approach. Can you tell me how you evolved to where you are?
Well, I've always been interested in medicine and diseases since a young child, age 8. And I just was always reading medical encyclopedias, and I did my first kind of experiment when I was 17. I lost 15 pounds of body fat by walking to school instead of taking the bus, and just used fruits and vegetables and high quality protein. And I didn't know what I was doing then, but I was able to shapeshift my body very nicely and healthfully. And it progressed from there. I studied naturopathic medicine of the European tradition. After that, while I was in the military for 6 years, I worked as a hospital administrator. And while I was doing that, I was studying natural medicine at that same time. It wasn't much out there in the 70s with natural medicine, but I was studying the European tradition, which are much further ahead than us. And once I got out of the military, I set up my practice in Minneapolis as a wellness coach, just using nutrition and wellness and exercise as the typical things. Found that it was pretty limited because people had a lot of emotional baggage, and they weren't able to really take care of themselves. They weren't really able to do their wellness program. So that got me interested in psychology and the emotional aspects and the mental aspects of health. When I moved to the Detroit area in Michigan to marry my husband, I earned a PhD in clinical psychology in the humanistic transpersonal tradition. So my specialties is spiritual psychology beyond the personality, beyond the ego, to address the more, say, non-ordinary parts of the person. So now with my practice in Michigan, which I've been practicing for 23 years there now, well, altogether, I specialize in the full person, the holistic person, truly spirit, body, emotions, and the physiology.
That's what I was just going to say, is it sounds like your background has prepared you to deal with all aspects of
the whole
human
person,
being.
yes. Because if you just take the person apart and just do this, it's very limited. And that's what the basic paradigm is, a set of beliefs. Paradigms are a set of beliefs that inform your actions. And the paradigm of standard medicine is one symptom, one medication, or a surgery, or a particular drug. With a holistic approach and a functional approach, we really address every part of the person, the stresses they're under, the emotional aspects, the childhood traumas that actually create structural changes in the brain, the whole physiology of the body. Because if you have, let's say, depression or anxiety, if you just think your brain is separate from your body, you have to work with the body so that you can fix the brain. Some people separate that brain and the body, which is not real logical, but they do.
So let me understand this. The definition of functional medicine is the whole body, or clarify for me what functional medicine is.
Yeah, that's a new word. It's come out in Jeffrey Bland is, say, the granddaddy of functional medicine. He has a big institute out in Gig Harbor, and he works with many, many thousands of people every year, his whole staff, looking at what what balances the functional pathways of the body. So the basic tenets of functional medicine is biochemical individuality. Everybody is totally unique. Secondly, we have to balance those biochemical pathways. They get out of balance through myriad ways, toxicity and lifestyle and stress and genetic predispositions. So these pathways are needing to be balanced, and then we intervene to balance those systems with natural approaches, non-toxic natural approaches that do no harm.
How interesting. This is all new to me. You mentioned depression and anxiety, and I know there are many people who struggle either in silence or they take medications that don't work, and they just don't know where to go or what to do. You take a holistic approach to depression and anxiety. Tell me more about that.
It's so important to not get caught in the medical model with psychiatry, because if you go to a psychiatrist, very different than what I am. I'm a psychologist. A psychiatrist is a medical doctor.
And most people don't know the difference.
Know that difference. Psychiatrists are medical doctors, and today, if you go to one, you will probably come away with one or more medications. That's what they do. They prescribe. And it's the only specialty of medicine that prescribes without looking, because you really can't look in psychiatry, because there's really no specific tests that you can take, a lab test that show that you got this kind of depression, or you've got this diagnosis or this differential diagnosis. So they're really guessing. They're really guessing. And actually,
the medicines are very, very complex.
Very complex. So actually, the body's biochemistry is infinitely complex. Basic nutrition and lifestyle is very simple, and that's that distinction. So these medications are very addictive, and they don't really work for a lot of people. So if one doesn't work, then they try two together, and then if those two don't work, then they try two or three different ones. And in real severe depression, they often just do electroshock therapy. That's when it gets real severe. I had a patient a client a year ago that was put in the hospital for severe depression. He was called sort of catatonic. He couldn't move. He just sat in a chair and could do nothing. So they hospitalized him for 2 weeks. He had multiple shock therapy, brain therapy. And when I saw him, he got out of the hospital, he saw me, and I suspected there was more going on in his physiology. So I gave him what's called a functional adrenal test to show what his cortisol was doing. It's a 24-hour saliva cortisol test. And he came back as almost a flatliner. A flatliner means he was not producing any cortisol in his adrenal glands, which can mimic the symptoms of depression. So can a very low thyroid called hypothyroid. That can also mimic depression. Symptom for symptom, you can't make a distinction between thyroid adrenal because they go together versus clinical depression.
So what you're telling us is that there are other things that can be going on with the body that may show symptoms of depression that may not need or don't need medications, depression medications, that you can fix by identifying other things that are going on.
One of the jokes in our field is that nobody has a Prozac deficiency.
Exactly.
Yeah, it makes people don't realize that those kind of SSRIs, they actually give you a much more tendency to be suicidal and sometimes homicidal. And there's a huge, especially in the developing brain, like an adolescent brain or a child's brain, a very different kind of brain than an adult brain. So you're putting very powerful medications in a very immature nervous system. And it's an experiment.
When you talk about functional pathways, are there other things that can cause depression and anxiety? Do you do a multitude of tests, or? We do the regular lab tests. I have a doctor that oftentimes does specialized lab work that I request, and we do the typical labs. Like, for example, vitamin D. It's a real popular topic today because so much research is being done with vitamin D. Vitamin D works directly on the immune system and the nervous system, and it's connected to depression. People don't realize that the typical clinically depressed person has been found to be omega-3 deficient. That's fish oils. Nobody gets enough fish oils in their diet. Even the best natural diets don't have omega-3 unless you're eating
omega-3 fish, and most people eat farm-raised fish, and there's no omega-3 in the farm-raised fish. And people don't like sardines. That's a really good fish to use, but most people won't eat sardines. So they're really not getting omega-3 in their diet. You have to take a high-quality fish oil to really get enough omega-3 in your diet.
Well, I know that everybody watching this is going to want to hear more about this. Hold that thought. Don't go away, because when Leading Experts returns, we'll continue to learn about cutting-edge methods to heal, transform, and fulfill your life with Dr. Elizabeth Borg, a licensed psychologist, wellness and life coach, and a public presenter.
Leading Experts is produced and directed at the Palm Springs Studios in La Quinta, California.
Welcome back. We're discussing cutting-edge methods to heal, transform, and fulfill your life with Dr. Elizabeth Borg, a licensed psychologist, wellness and life coach, and a public presenter. We were just having a fascinating conversation about holistically treating anxiety and depression. Do you think, I had this conversation with another doctor who told me that people are born with anxiety or depression. If that's the case, do you think a holistic approach still works? Do you agree that people are born that way?
I categorically disagree with that particular stand, and that's called endogenous depression. It would be, there are people that have maybe a genetic predisposition to depression and diabetes and maybe bipolar and and autism, that kind of thing, but it's the environment. In functional medicine, we talk about the environment bringing out the genes. Genes are maybe 10 to 20% of the equation. The environment is 80 to 85% of the equation. The environment, there has to be something in the environment to bring out the oncogenes, the cancer genes, the diabetic genes, the depressive genes. Sure, they're going to be discovering a predisposition, but it's the environment that brings it out. If you were in an Indian village eating lentils, beans, and rice, your diabetic genes will probably not express in your lifetime.
Because your system gets weakened for these environmental reasons, and then you're more likely to develop. That makes perfect sense.
Yeah, the high fructose corn syrup is one of the main factors today that's bringing out the diabetic genes in a lot of people and making them sick, fat, and inflamed. Because basically that's what Americans are. They started, I believe, let's see, what they started putting high fructose corn syrup, I think, in 1986, and they used to use just regular sugar, which is glycemic, but not nearly as glycemic as high fructose corn syrup, which is a completely genetically modified sugar that just knocks the insulin receptors right out and just really messes up the.
So I take it you don't agree with that commercial sugar is a sugar is a sugar? No.
Absolutely not. Absolutely not.
Are there, when we're talking about holistic health, are there other things that prevent people from being well or from being happy?
Yeah, now we're getting into more of the more subtle areas of the whole person, such as early childhood trauma, which actually creates different changes in the brain structure. When you're beaten or emotionally abused or sexually abused as a child, you have your brain develops differently than someone that is nurtured in a loving way. So you have the early childhood developmental stuff that interacts with the environment, with poor diet and abuse, and all these factors go into this mix of creating damage in the brain, the nervous system, and other parts of the body. So that would be and then of course there's the more mundane kind of things which affect people's ability to take care of themselves, and that's what we call like subconscious programming. These are the programs that you get from your parents, from society, from your ancestors. It's very interesting that now with this family constellation work, it's called Heller work. It's the #1 therapy in Europe today. They look back at least 3 generations for things, diseases, and emotional patterns and different things that come 3 generations back from your family. So you can inherit your family's dysfunction 3 generations later. I had a client that I have been treating for obesity, very interesting enough, and she was carrying her weight for her mother. Actually, she found out in her deeper work, which we work with Body and Mind in deeper work, that she was actually carrying the family's fat. And she was able to give it back to her family on an energetic level. And she was able, that was one of the factors that she was able to let go of her fat.
And she might have let go of other things too.
Yeah, she let go of a lot of things, like her diet, her poor diet. We did a complete holistic approach. She was working on many levels, and I believe personally that a person that is obese cannot really achieve permanent body compositional health without a body-mind approach. You can't just go on a diet and expect permanent weight loss. You need to dress the full person. People can lose weight, but they will not keep it off. They have these unconscious set points that keep them from permanently keeping the fat off for 5 years.
So when you don't just medicate somebody,
Yes.
and you find the cause of what's happening, then you're
Yes.
more likely to have a lasting result.
And there are many causes. That's the thing. People want to simplify and make the magic bullet and try to find this magic vitamin or this, but no, there's really no magic bullet. But there are some very simple, basic things that one can do: eat right, drink right, think right, move right, sleep right, poop right. And with relationships, talk right, because it's about communication. The number one reason people seek a therapist is because of relationship stress, and with parents with their children and spouses. I mean, that's a big area in psychology. There's a lot of stress with relationships.
So what you're telling me is that there is I'm not just going to contact you because I have a relationship issue, but my body and my mind are connected.
Yes.
And I could see you about anxiety, depression, weight loss, relationships, and they might even be interconnected.
They might all be
my
connected.
depression, my weight, and my troubles in my relationship might be connected to my overall health.
Absolutely. In fact, some people think hypoglycemia, which is low blood sugar, actually causes divorce rates to go up, because when people are in a low blood sugar state, they're irritable, they're moody, they can't communicate, they feel very dysphoric. They treat people bad. Sometimes they resort to violence and spousal abuse.
And I can see that with, if I have depression, it's going to be harder to keep a relationship. If I have anxiety, it's going to be harder to keep a relationship. And those things may affect my weight.
You can't separate the body and the mind.
So if someone is struggling with weight loss, they might come to you to look at their whole system.
Yes.
To deal with, let's say, just weight loss, and they may find that there are other things going on.
Yes, it's very common, especially in my women clients. They get a certain amount of weight off, and my first line therapy works only with fat loss. So they lose fat and they start looking gorgeous, and they start going down in their dress sizes, and they start getting what's called sexy. They have the potential to be in an intimate relationship, and that becomes very threatening to them on an emotional level on one of these programs, because they've kept their fat on because they are protecting themselves. So that's one of the unconscious reasons why people will stay fatter than they need to be, is because it's protection, especially for women. I found this especially in women's psychology.
How long does this process take? If somebody says, listen, I want to find out how I can take this weight off and how I can keep it off, how long does that take to